mynews.studio.
A single cigarette or skipping a wash on your apple. Could just one small choice really shift the scale on cancer worldwide?
Today's date, February 6th, 2026. Let's dive straight in. There's a major global study out. More than a third of cancer cases, so about 7.1 million a year, are preventable. That's out of millions of diagnoses spread across 185 countries. What's driving this? Behaviors and exposures we actually have some influence over. Tobacco, diet, alcohol, and environmental factors.
Absolutely. The numbers really stand out. Tobacco alone causes 15% of all cancer cases around the world. Infections like HPV or hepatitis add another 10%. Alcohol accounts for 3%. And then there's obesity and high BMI increasing risk too. But these figures aren't uniform everywhere. For instance, in sub-Saharan Africa, 38% of women's cancer cases are tied to preventable causes.
Right. And then looking at East Asian men, it's even more pronounced. 57% of cancer cases there are considered preventable, mostly due to tobacco and alcohol. These regional differences, what's really behind them? Is it mainly culture, or are health systems and access to prevention playing a role?
It's a combination. In some places, tobacco and alcohol use is widespread. In others, infectious diseases are more common because health infrastructure and vaccination rates fall short. The study highlights policy interventions that are proven to work, like tobacco taxes, bans on smoking in public places, public education campaigns, and vaccines for HPV and hepatitis B. Where these are in place, we've seen cancer rates drop.
So, what makes an intervention really work? Is it just about what governments do, or do communities and individuals need to be involved too?
Both matter. Take HPV vaccination. It works best when it's accessible and people trust the system behind it. Lifestyle changes, keeping a healthy weight, drinking less, staying active, those come down to personal choices. But it's much easier to make better choices when the environment helps. Think food labeling, city planning for safe walking, even limits on advertising.
There's data from the US in the study. If people keep their BMI between 18.5 and 27.5, cut back on alcohol, and stay active, up to 20% of cancer cases could be prevented. But how realistic is that, especially in places where resources are tight?
That's the crux for low and middle-income countries. Health systems can be weak, cancer screening limited, infection rates high, and awareness. If people don't know the risks, they can't act. That's where international support steps in. Organizations like WHO and IARC are providing technical help, funding, and education to close those gaps.
We know the tools: policy, vaccines, lifestyle change. But there's no universal blueprint for implementing them. On a bigger scale, survival rates have doubled in some countries since the 1970s. Could we see a major shift in the global cancer burden if prevention gets prioritized?
That's the aim. Prevention isn't just an option for wealthier countries. The tools are there, and they're not expensive. The real issue is whether governments and communities will put them first. There's a real chance here, not only to save lives, but to ease economic pressure and reduce health inequalities.
But prevention's only part of it. As new treatments like gene therapies become available, who gets access? How do we prevent new advances from increasing the gap between countries or groups?
Exactly. That's why this conversation matters. It's not just about reducing risk, but about fairness, access, and giving people the information they need. If 1 in 3 cancer cases could be prevented, what would that mean for families, health systems, and whole economies?
It's a challenge for all of us. Prevention is possible, but it needs leadership and community support together.
Let's wrap up. 1 in 3 cancer cases are preventable. The main risks: tobacco, infections, alcohol, and obesity. We know what works, but putting it into practice varies widely. Countries with fewer resources face bigger hurdles, but international help can make a difference.
As survival rates improve, prevention becomes even more vital. The choices we make and the policies we support will help shape how cancer affects the world in the years ahead.
Thanks for joining us. This episode was brought to you by mynews.studio. Give it a try. Free now.